This article was sent to me by Julius Garcia, and this is a picture of New York Governor Andrew Cuomo. Now, this is the first time I've done a video about him on my channel. I did a video about his brother last year from some incident that he was involved in at some kind of a festival. I almost forgot what it was about, but it's whatever. And speaking of Chris Cuomo, if you didn't know, he just found out he was tested positive for the Wuhan, and he's been secluded to his basement in his house. So anytime he does his broadcasting, he has to do it from his house for the next 2 weeks. But the most vocal political figure that I have seen pretty much daily for the last couple of weeks talking about this is Andrew Cuomo. Like, you can't really go anywhere and not see a TV screen with his face on it, especially if it's on CNN or something like that. And he's been talking very vocally about this virus for a while now, and probably is one of the most honest people about it, especially with this statement that he just recently made, in which I'm going to talk to you about right now. He basically came flat out and said that this virus is not going to get the U.S. back to normal. Whatever the U.S. was functioning as 2 weeks ago or 2.5 weeks ago and beyond is no more. After this subsides, because I don't think it's going to completely pass, just like a fly-by-night type of thing. Otherwise, it would have been here and gone. Once this phase, I should say, of it kind of settles, the U.S. is, as we know it, is going to change forever from here on out. This is going to be way different than when 9/11 happened. This is going to be way different than when what happened in 2008 when that recession happened. This right here is a whole nother monster that we're dealing with right now, because not only did it affect the U.S., but it affected the entire globe, and all the continents are working, kind of with each other in various situations, but in different ways. But they all work together in some form of fashion. And I said that, and I think a few months ago, I said that we're going to be headed into a new recession. I don't know when it's going to be. I don't know what's going to cause it. But this right here, for certain, is definitely the leading in, or the ushering in, I should say, of a new recession. And this one is going to be major. It's probably going to make the Great Depression look like child's play. Just between what we've seen financially and what we have seen with people, the casualties with the people getting laid off from work, the kids not being able to go to school. It's like, the reason why I say it's like going to make the Great Depression look like child's play is because every time something comes on about this thing, it's getting more and more depressing. Like, you hear so and so many people died. You hear people are, losing their jobs. The nurses and the doctors and everyone who works in the hospitals, they are going through it right now. And the bad thing about it is it's only going to get worse. I actually just found out today that in the state of Michigan, they are on a lockdown until June 16th. That is 10 days after Virginia is supposed to be lifting their quarantine. Now, as for us, where I'm at right now, we're still until the 30th, but I will not be surprised if something changes between now and that time. Like, you got to think, these people who are in those states are on lockdown for the next 2.5 months. Like, it's real. And for those of you who out there who still think that this thing is a hoax and that it's a joke and it's not to be taken seriously because personally you don't feel that it is or should be, keep thinking that way, and we'll see how you are by the end of this month. I would say by the end of the quarantine period, but something tells me many of you probably going to lose it by that time. I hope that's not the case, but some people have already lost it. And we've only been a couple weeks, almost 3 weeks in. It doesn't feel like it, but it's crazy to believe that we're about 16 days, since me recording this video, that we're about 16 days in. But I'm going to go ahead and read this article coming from The Guardian. New York's Governor Andrew Cuomo said on Wednesday he thought Americans would be living in the consequences of the Wuhan pandemic for a long time to come. I don't think we get back to normal, Cuomo said. I think we get a new normal. He declared it was America's responsibility to ensure the change brought by the pandemic will be positive rather than negative. Cuomo also emphasized that all U.S. states need to be better prepared for such crises because something like this will happen again. On Wednesday afternoon, Florida issued a statewide stay-at-home order to its residents after days of resisting pressure from health officials and even Washington as cases in the state surged towards 7,000. New Jersey is also reaching worrying levels of illness, with the small state coping with 18,000 cases and 267 deaths so far. Cuomo reported in his midday address, which discussed the situation in New York, but also saw him expand to give information beyond his borders. New York State has confirmed 83,712 cases of the virus, making an increase of 7,917 since Tuesday, and the virus has claimed 1,941 lives in the state, up from 1,550 yesterday. Of those, about 1,000 deaths have occurred from the virus in New York City, now the center of the epidemic in the U.S. Cuomo noted many people are looking for answers about when this crisis will end, but he said it was currently impossible to say. Nobody knows what's going to happen. That's another part that I appreciate about what he said. When people ask him that stuff, he's being very transparent. He's not saying he doesn't know when it's going to end. That's the best thing that you can say right now, unlike some people who want to give a date and a stamp on things. That's why I said I thought it was a bad idea for them to come out and say who this virus affects and who it doesn't, because as you can see, it affects any and everybody that it touches. And for them to come out that early in the game and say, oh, it's only going to affect older people with pre-existing conditions. Oh, it's going to affect children. But as you can see, it can touch anybody of any age, whether they have a pre-existing illness or not. It's just that with some may be able to fight it off and some will not be able to, depending on what their conditions are. But even then, that's still a toss up in the air, as you have seen with a couple examples that I've given you so far on my channel. So I thought that was very, premature of them to do that. And don't get me started on 45 saying we're going to have this thing up and running by Easter. As you can see, we've been expanded to the 30th and Virginia to the 6th of June. And now the state of Michigan to June 16th. And then I'm expecting more states to follow. I have a feeling this thing might, on a federal level, on a national level, this thing is probably going to go beyond April. I will not be surprised. I mean, between, them canceling graduations, people having to postpone a lot of different things, it's serious out here. This is not a joke. This is not a hoax. It is not a game. He announced that city-controlled playgrounds in New York City will be closed, which affects not just children playing, but community basketball, volleyball, and other such activities, because people are not staying apart. And see, that's what I keep telling people, the arrogance of America. People keep saying, stay apart, social distancing. But many people can't do it. I said, if people were to do that, then it could slow down what's going on. But people cannot help but continue to go outside. And see, this is the scary part, because now that the quarantine period is going to be extended, now it's going to push and pressure people to want to go outside and be around other people. And see, because a lot of people aren't working a particular job or, whatever that involves them having to be around people, now their income is affected. So that's why I keep saying, take this serious. Take it very seriously. Because it's affecting everybody, no matter what your status is, no matter what your income is, no matter what your lifestyle is like, no matter what your social construct is. It's affecting everybody, not even just here in the States, but around the world. Cuomo predicted that based on modeling projections, the worst time for deaths in New York will be the end of April, prompting the need for 75,000 and 110,000 beds for the Wuhan patients, and between 25,000 and 37,000 ventilators for extreme cases, depending on how effective stay home and physical distancing orders are. By Wednesday midday, the U.S. had about 188,000 confirmed cases and the death toll was 3,918. Worldwide, about 900,000 people have been infected and about 44,000 have died, according to a tally kept by Johns Hopkins University, though the real figures are believed to be much higher because of testing shortages, differences in counting the dead, and large numbers of mild cases that have gone unreported. I believe that that number is going to reach 1 million probably by the middle or end of next week. Healthcare workers who have hit the ground already, many brought in by staffing agencies, have discovered the hospital system becoming overwhelmed. Some patients from New York City have transferred to Albany. I have never seen so many human beings in the ER at one time in my entire life, said Liz Schaefer, a nurse from St. Paul, Minnesota, who had her first shift on Tuesday at Mount Sinai Hospital. Shoulder to shoulder, it is a sight I have never thought I would see. Patients are dying every day, every single day. With New York on near lockdown, the normally bustling city streets are so empty that a single siren to some is no longer the easily ignored urban background noise. After 9/11, I remember we actually wanted to hear the sound of ambulances on our quiet streets because that meant there were survivors, but we didn't hear those sounds, and it was heartbreaking. Today, I hear an ambulance on my strangely quiet street, and my heart breaks too, said Meg Gifford, age 61, a former Wall Streeter who lives on Manhattan Upper East Side. With many city police officers and fire departments EMS teams off sick, the city is experiencing a shortage of ambulance drivers and paramedics as well as law enforcement officers. Meanwhile, Mike Pence compared the United States to Italy in terms of the effects of the virus on the two countries. We think Italy may be the most comparable area to the United States at this point, the vice president told CNN on Wednesday in response to a question about death toll projections. Italy has seen the highest numbers of the virus deaths, already losing more than 12,000 residents to the pandemic. White House officials said yesterday that up to 240,000 Americans could die of the virus even if physical distancing measures are maintained. Pence said those projections underscored the need to be vigilant in social distancing efforts over the next 30 days. And I'm just going to say this. They're not saying this to scare you or inflict fear porn, quote unquote, into people. People like Andrew Cuomo is being as transparent as he possibly can, instead of sugarcoating it to try to keep the masses calm. At this point, there really is no calm. At this point, people have already panicked and are still panicking and will continue to go through a stage of it, or stages, because many people have never lived through something like this. Trust and believe, this is something we're going to look at years down the line and are going to tell the generations that come behind us that we're not here to experience this, or maybe we're too young to remember what happened. Just like with 9/11 and everything like that. There's always certain things in history that you live through that you can't wait to tell. This is going to be one of those ones where you will kind of not want to talk about, but it's going to come up and we're going to be like, oh my God, we got to talk about this again. Imagine 10 years from now in 2030, when this has passed us, hopefully, that we talk about this. Like when the next decade comes in, they're going to ask you, what do you remember most about 2020 to 2029? Oh, that Wuhan back in 2020. Most definitely. When they do the year in review for this year, this is what's going to be talked about heavily. It's going to be talked about heavily. But people, like I said in my previous videos, have got to take this seriously. This is not a game. This is not a joke. And ironically, I'm recording this video on April 1st, which is supposedly April Fool's Day. It is nothing foolish about this whatsoever. Like, I never took this thing as something not to be taken seriously from jump. But, a lot of people believe things that people put out there and they don't have any solid proof, but because it came from a certain person or certain people that they like, then it had to be true. But then if they end up with it, then it's like, oh my God, you lied to me. Well, you were foolish to believe it. Y'all let me know what y'all think about this down in the comments. Like, share, subscribe. Make sure you follow me on Twitter if you haven't done so already. Have your notifications turned on, and I will talk to you in the next one.